I know that people don't show up for elections because of the cynicism they feel because of decisions like these that seem beyond our control. Cynicism is a booming commodity in this province, and it grows in between the words of promises unfulfilled and broken. And we have to turn that around.
One possibility for social change is to participate on nowpolling.ca. Your opinion is the essence for social change, self-government, or direct democracy. Nowpolling.ca is here to register it, publish it, and count it, so we can be clear about our collective will. And the results of this poll will be potentially a tool to demand for what we envision as social justice.
What have they learned in the last 4 years? Remember, we had Dr. Patricia Baird's Seniors Council, and that was appointed by our Premier. Cost covers to send them all over the province to find out what seniors needed. Did they do anything? Do you know the one recommendation they took? You don't have to retire at 65. So, you know, that was the only recommendation out of that report. Then we had the conversation on health. What did they hear? Keep our health care public, look after our seniors. Was anybody listening? And then we have the Ombudswoman, who just turned out a marvelous report, of which we've had the first part of. 10, you heard earlier, 10 recommendations, simple, non-costly. What did they do? 4. 4 they took in. Is anybody listening in that government? I don't think so.
Rather than addressing the issue of drug use on our streets with public health approaches, we've seen VIHA work with the police to attempt to control downtown space through policing and restrictions on the ability of outreach workers to connect with the people they're mandated to support. Instead of making it easier for people who use drugs on Pandora to access supports and services, VIHA has stationed security guards at the entrance to their building and restricted outreach workers from distributing safer drug use supplies in that area, effectively undermining relationships outreach workers hope to maintain with their clients. Please, show some courage, show some leadership. Show us that this health authority will make decisions based on health evidence rather than moral panic. Let's make no mistake, drug use will continue to occur on our streets as long as we fail to respond to it with the ample public health evidence available to us. In 2008, Dr. Benedict Fisher and Dr. Perry Kendall drew on public health evidence and called for supervised consumption services in Victoria in the BC Medical Journal, and I quote, "There has been an increasing number of public and business complaints concerning the public order problems of public injecting, discarded needles, littering, loitering, associated with high-risk drug use in the downtown core. These are exactly the problems that supervised consumption sites are designed to address," end quote. Dr. Fisher's feasibility study on supervised consumption options for Victoria in 2007, which was commissioned and jointly funded by VIHA and the city, noted that a survey of health and social service providers, businesses, community and tourism reps, law enforcement reps, and people who use drugs showed strong support for multiple sites offering supervised consumption services in Victoria, and that there should be one or more contact centers established for people who use drugs. Harm reduction challenges many people's convictions about the moral worth of people who use drugs. Your jobs, if I may so boldly suggest, are not to act on those moral convictions, but to fulfill your mandate to deliver prevention and care services, to develop evidence-based responses to disease transmission, and to engage and serve vulnerable populations. People who are opposed to these services in our communities do not have the same information that you do. You need to share this information, but you must not wait to act on it. I promise you that if you take action, there are those of us who will bring everyone else along. While you wait, while you compile reports, while you make excuses, there are those of us that are taking action. But it's not enough. Please join us.
Given this situation, it defies logic to suggest that the removal of 18 acute care beds from service for acute care patients, and the layoff of nurses represents an improvement in care. We are living with the result of the 2006 decision to award the contract for new long-term care beds in the Comox Valley to a private for-profit operator, Retirement Concepts, over the publicly funded not-for-profit Glacier View Lodge, which also made a proposal at that time. The hospital is in overcapacity. Seniors requiring residential care are served inadequately in acute care beds, while over 30 beds are empty at Retirement Concepts Comox Valley Seniors Village, because those beds are only for rich people. How can VIHA claim that this is socially responsible policy? When we ask for explanations, we get the paternalistic, "We know what's good for you, leave it to us," from St. Joseph's administration, and have yet to hear a word from VIHA.
And I'm here today representing my constituents, the citizens of Oak Bay, who are concerned about the future of seniors' health care in our community, and specifically the immediate fate of Oak Bay Lodge, its residents, and the impact on their families. This concern is echoed by the 1,600 signatories of the petition that you received earlier today. This is unacceptable from an operational point of view, does not demonstrate transparency and honesty with elected officials and the public, and I would suggest disrespectful to the citizens who use these facilities and their families. Oak Bay Council's resolution of March 19th, which passed unanimously on March 22nd, clearly states support for retention of the land in public ownership of the Oak Bay Lodge site and upgrading or renewal of a publicly owned, operated, and managed campus of care facility in that location. VIHA's intention to sell off these lands in the public trust is cause for serious concern in my view. Why sell the lands and risk them being resold later? A long-term lease would serve the same purpose, yet keep the lands in the public domain, essentially in perpetuity. At the January council meeting, Mr. Waldner stated that VIHA was selling the land because they needed the money. Liquidating assets to generate cash is a short-term strategy at best and does not address the ongoing longer-term care and housing needs of our seniors in our communities. Once the lands are sold, they are removed from public control and accountability for good. We therefore request that the VIHA board consider making a motion to reopen the decision and rethink their plans based on substantive evidence. The citizens of Oak Bay deserve answers, and I am asking you on their behalf for complete information on the cost of renovations versus replacement of the Oak Bay Lodge facility. This issue is not only about beds, buildings, and bottom lines, but also about quality of life and options for housing and senior care provision. Please remember the people and their places in your deliberation. Thank you very much.
Now is your turn to agree or disagree with our healthcare issues. NowPolling.ca is a potential tool to bring about that social change you want. It's up to you to participate in the building of a better world. And remember, the choice is in your hands. Your participation is the essence of direct democracy.